Welcome to the Center of Everywhere podcast, where we explore stories of rural Minnesotans who are making a difference in their communities. Rural isn't in the middle of nowhere. It is in the center of everywhere.
Welcome to the Center for Rural Policy and Development's Center of Everywhere podcast. I'm Marnie Werner, Vice President at the Center, and with me today is Kelly Asche, our Research Associate.
Hi, Marnie.
Hi. Today, we're going to be talking about, well, what would you like to call it? The impact of COVID?
Yeah, I think some of the trends that we've seen, going through COVID, both in terms of people's health, sickness, deaths, but also some of the economic trends, right? So, this was a global pandemic, something incredibly serious that impacted everybody across the board. And so it's really, looking at trend lines in our economics, our workforce, and our healthcare and our childcare. We're going to see blips, right? It's going to be something that's kind of outside of the normal trend line. So that's what we're starting to look at now that the data is starting to filter in and come back from the past couple of years. And so now we can kind of get a sense of what did the impact do?
And that's the thing that I thought was kind of interesting, is that this is new data. There's not an abundance of data on this yet, even though you would think there would be, but we have like the basic once over lightly kind of information, statistics now. And so we can look at those, but there'll be a lot more in the future to come, right?
It's always the issue with data and the work that we do, Marnie, right? Is everybody wants the answer of how they're feeling and seeing things right now, but the data lag is always 1 to 2 years out. And so we always have to say anecdotally, this is what we're seeing, but in 2 years, we'll have some data to let you know actually what happened.
Yeah, that's it really. It's we work with what we have. So I guess the first thing to look at then is, the number of cases and where they hit in the state and who they hit in the state, and any speculations as to why.
Well, that was quite interesting. I have to admit, before seeing the data, I kind of was operating under the assumption that a lot of public health and a lot of research around pandemics in the past is that typically they're worse in places where you have highly dense populations, right? Because it's just so much easier to spread it around. This is kind of the way it always was historically during pandemics, is that it would hit harder in these areas where a lot of people are around. And then when you had more space, it just didn't spread maybe as much. And now after looking at the data, what's kind of interesting is really what we're seeing is that the impacts are greater in places where health outcomes are worse. So in terms of infections and the spread of COVID-19, it follows kind of what you would expect, that more densely populated areas typically saw a higher rate of infection of COVID-19 than in rural areas. Interestingly, though, is there seems to be a little bit of nuance in there, in that, how we usually do things. We group some counties into entirely rural counties, and then we have counties that are town and rural, and then we have counties that have some urban, some town, and some rural, and then we have counties that are entirely urban.
That's more of a reflection of their population density, right? Not necessarily so much where they are.
Correct. Yeah, population density, as well as what I call their connection to places. So that part of that of being an urban or a town area is if you're in a small town, but 30% of your population is going to a larger city for its employment, then it might be considered a town. Just because of that that way that they're connected through employment. So it's not just about population, but also commuting patterns as well. And so what's interesting, based off of that, is our entirely urban areas isn't just a 7-county metro, but it's also these pockets in greater Minnesota where you see entirely urban counties such as Blue Earth County, where Mankato sits, and St. Louis County and Duluth, and where Rochester is down south and those types of counties. So when we first ran the numbers, just looking at infections, so we're not looking at the number of deaths, just infections per 100,000 people, what was interesting is that those entirely urban counties was actually quite low. So entirely urban and entirely rural counties were pretty similar infection rates. And the highest was actually in the urban town, rural counties. So that might be more like, what would be a good example of
Alexandria?
Those types of places, right?
Wilmer?
We saw really high infections in those counties. I think we had a conversation about this. We're like, well, that's kind of interesting. Why would that be? Why didn't that follow? And I think it was you or Whitney brought up, how about if we took out the 7-county metro out of the entirely urban group? What does it look like then? And interestingly, as soon as we took that out, the 7-county metro, the entirely urban counties that are left, which again was like Blue Earth, St. Louis, and some
Mankato,
lowest,
St. Cloud.
it was number one. It was the highest rate. And so there was definitely a change there was a relationship, I should say, in being inside the 7-county metro and being outside of the 7-county metro. Very, very different infection outcomes. And this raises a lot of really interesting questions that I really can't answer. We can only kind of speculate on at this point. And I think as we continue to kind of look at the data and we kind of have a more retrospective assessment of what all went down during this, I think we're going to come up with some really interesting ideas about what worked, what didn't, how much of this is cultural, how much of this is infrastructure. I don't think we have a good grasp on as to why. And I hate to speculate, but I'd be curious what you think about that, Marnie. I mean, when you got out of the 7-county metro, even if you were urban, you were super high. And then if you were urban and the 7-county metro, it wasn't very high.
Yeah, well, we mapped those cases out too by county. And of course, a map doesn't do much good when you're on a podcast, but we'll try and post the map with the podcast on our website. But you can see there's a really definite pattern of which counties have the highest case rate, which is cases per 100,000 population. That way we can equalize the cases across counties. And when you look at the map, the highest rates are in counties like Stearns County, Candy-Ojai, Benton, Mower, and those counties around Austin, Freeborn, Nobles County, where Worthington is, and then Roseau County. And the one thing we could think of that those counties really have in common is they are big manufacturing centers. And a lot of that manufacturing in some of those counties is food production or other manufacturing that was deemed essential towards the beginning of the pandemic. And so those were places that were exempt from shutting down. They didn't have to shut down right away, but early on, they also didn't have the safety precautions in place yet because there just wasn't time and they didn't have the materials yet and things like that. And so I would think, when we check this, going forward, I would think some of this would coincide with like the stories of early in 2020 of some of the food processing plants, the big ones having to be shut down because so many workers were sick. And so, I suspect that's going to be a big part of it.
Yep. And I think you're absolutely right. I think that is a big part of it. I think in today's political climate, the way that we talk about urban and rural, a lot of it sometimes gets blamed by, they just didn't wear their masks or, the vaccines were a little bit lower. And all these did play a role for sure. I don't doubt that. But also I think probably a larger aspect of it is just flat out industry makeup, where people having to work in close quarters to each other during the pandemic when it was at its worst, and that first wave hit them really hard. as you were saying right away.
Absolutely.
And I think this ties into kind of the next piece of looking at deaths per 100,000 people, again, to equalize that. And, as I said before, infection rates, particularly in entirely rural areas, was super low, but the death rate was super high.
Right.
Yet in those counties that we were just talking about, where they had really high infection rates, they had really quite low death rates. And I think what we're seeing is that in those communities, in those kind of entirely rural and rural counties that have high number of manufacturing people, they're typically younger workers, probably a bit healthier. And so we're able to kind of withstand the infection, I think, a lot more. Where when you get into our entirely rural counties, we have a much older population and a typically quite a bit unhealthier population. And, all the data shows that the infection in COVID-19 was particularly hard on these two groups. I always struggle with this word, Marnie, but it's a comorbidity.
Comorbidity.
Yeah, that probably played a pretty big role in our entirely rural areas, where typically a larger percentage of the population has to deal with a lot of type of health issues, particularly if you're older. So
multiple health issues, like you might have diabetes, type 2 diabetes, and a heart condition, and you're overweight, and that kind of combo pack of health issues was especially hazardous for people when it came to COVID.
So I think that's what's kind of interesting. I think, a big story that's going to come out on this data is we can't just look at infections in terms of how successful we've been. There's a lot of nuance there regarding infection rates. So high infection rates didn't necessarily equal high death rates in terms of when we started looking at it as ruralness versus urbanness. But it's going to be a lot of other factors, industry makeup, the demographic makeup, the health makeup of the communities. These are all going to play a pretty significant role, and it's going to get complicated to try and tease out a lot of those variables. But, I think it falls in line with what a lot of us were thinking is like, yeah, it may not spread as much out here, but if it does spread, it spreads to the people that it's going to hit the hardest and be most severe. And that's kind of what we're seeing in the data with our most rural areas in the state.
Yep. I think that's going to be a big story, one of the big takeaways from this. Yeah. So vaccination rates. Yeah. You almost don't want to wade into this topic, but we really do, because, there's a connection.
Yes. There absolutely, that will be another one of the variables about looking at death rates. Why were they highest in places outside of particularly the 7-county metro? And one of those variables is going to be vaccination. I mean, the data is completely clear that if you're vaccinated, the chance of death and having severe reaction to COVID-19 is significantly lower. And so, we were able to look at vaccination rates by county. And we kind of grouped them together again by, our entirely rural to entirely urban spectrum. And not surprisingly, our entirely urban counties had significantly higher vaccination rates. And I should say that this data that we got is up to the beginning of February. So we're a little bit, it's lagging now, but I know continued vaccination has really dropped off. So it's probably hasn't changed that significantly since this time. But in entirely urban counties, we were in the state of Minnesota right around 75%, either having one dose or both doses. Both were, having one dose was near 80%, and having both doses was closer to 72% or 73% in those counties. So pretty high, and I think that's really, really good. Some of the areas that are the types of counties that saw the lowest were, not surprisingly, the more rural we got. So for our rural counties, it was right around, having both doses, about 57% to 64% was kind of the range throughout a lot of our most rural counties. And interestingly, I think when we looked at the county map, just kind of looking at different regions, some of the lowest rates were actually I would say in our north central and just north of the 7-county metro, that kind of ring around there. We saw a lot of
Right.
counties there having, 40, right around half, 50% having both doses. And I don't have like a good explanation as to why that particular region was super low, because when you got into like really Western Minnesota, where we did have an older population, it was some of the higher rates in our most rural areas of the state was actually in some of those places in Western Minnesota. So that one
Yeah.
I can't quite explain. And it could be culture, it could be access to the vaccine. It could be, these are the types of places that have high commuting to the 7-county metro. I don't know if that played a role. Yeah, it's this one is I can't quite explain. I don't know if you have any ideas, Marnie.
Well, not really. Yeah, that's one of those things where we will just wait for more data and see what comes out.
Something like that might also require some qualitative methodology to have
That's
some
what I'm thinking.
conversations, kind of figure out what happened
what
there.
the story was. Yeah,
Yeah, but
exactly.
I think it is worth noting, compared to a lot of other rural areas in the United States, particularly when you get down to Alabama, Mississippi, and some of those, even Florida, our rural areas were significantly more vaccinated than a lot of rural areas in the United States. So that's something to be proud of, something to hang our hat on. So even though it was lower than our more urban areas, there was still, almost every county had over half of its population vaccinated. So
Yeah, that's still something to, that's still a something to, like you say, hang our hat on.
some
But
counties in the
yeah,
United States are, I don't know, they barely had 20 or 30% of their population
yeah,
vaccinated. So
yeah. Well, and now you had data on vaccination rates by racial groups and ethnic groups, and so that was some interesting data too.
yeah, kudos to the Department of Health in Minnesota to having this data available. It's been really fabulous to kind of peruse through. I think it's interesting, in rural Minnesota, we have a pretty good size population of immigrant refugee populations, which is a little bit harder to kind of tease out because in terms of the larger, let's say, African-American population in the 7-county metro compared to maybe like, let's say, the Somali population in Wilmer, they just dwarf it so much that we can't tease out too much because we couldn't get this data by county. So this is statewide data. But what's interesting is that looking at this information, so Asian Pacific Islanders had the highest vaccination rates in the state. One dose, they had 86%. This is the beginning of February. 86% of Asian Pacific Islanders had at least one dose, and 80% had both doses. That was by far the highest. The next highest percentage of race and ethnicity was white, was 71% having at least one dose and 67% having both doses. A little surprising. I thought that would be closer to, a little bit higher, but again, it would be really interesting to see what that looks like, the 7-county metro versus everywhere else in the state. I bet you would see quite a bit of difference there. Next up was Hispanic with 71% with one dose and 63% with both doses. And then it was Black African American. And then the last one being American Indian. This one we were kind of interested in rural Minnesota, large populations of American Indian. And they had the lowest. They were at 60.3% having one dose and a little over half, 54% having both doses. So, and I think that's quite understandable. I would, guess out of, all populations, according to race and ethnicity, American Indian would have been probably the hardest to get vaccinated due to some of the history of what they've had to deal with the American government,
Right.
vaccinations and things like that. A lot of mistrust. Very, very understandable. And I know we've had Christina Bowstring on our board and having conversations with others that are involved in some of our tribal nations in the state. They did a lot of work. They did a lot of work to try and get it. And I still think 60% is pretty darn good, honestly.
Yeah, and we had our COVID collaborative webinar last week that you weren't able to be on, but we had a couple of the panelists were members of the Mille Lacs Band from their Human Services Department there, and they had some very interesting stories to tell about vaccination on the reservation there. And yeah, it was just, what you were talking about. It's, vaccine hesitancy and just people being worried about, the information they're hearing, but also that history. And it's the same thing with the African American population and the history of the federal government experimenting on people with vaccinations and whatnot, and just, what's driven their reluctance over with all of this. And but just people that we've had on our 2 COVID webinars talking about that, and they've just explained, what was driving this hesitancy, and then also how they were helping people by just being available to answer all their questions and just helping people talk through their fears, and understanding that their fear is real, and just saying that's okay, and helping them out with it. And so that, that could explain why we have actually, even though they're the lowest, they're actually, probably higher than people from those groups in other parts of the country. And so, 67% and 60%, that's pretty good.
Yeah, I think so.
Especially considering that these groups traditionally just have trouble accessing healthcare.
I think another data point that will be really interesting going into the future is, you brought up African American and its history with the federal government, but yet they're lumped in with the Somali population. And I'd be curious from their perspective, coming from a war-torn country, a government you couldn't trust at all, coming in, how they responded and felt about the communication and the engagement with either the county government or county public health and getting the vaccine. I think that'll be some interesting information coming out, hopefully the next year or two, kind of taking a look at that stuff, because I would imagine it might be a very different reaction.
Absolutely. Yeah. So vaccination rates, and then hospitalizations. It's interesting, you put some charts together showing basically the bed occupancy and ICU bed occupancy, and you broke it down by region again, entirely rural down up to entirely urban. And it's interesting looking at it across time, because you could see that what looks like bed occupancy going up, but how much of that has to do with the fact that the total number of beds is actually going down?
A lot, actually. That was a little fascinating, because I think a lot of us felt like there would be articles coming out and headlines saying, oh, we're near our ICU bed capacity or a hospital bed capacity inpatient. And that was true. But a lot of it was because some of those beds, the number of beds available in total changed throughout the pandemic for a number of reasons. So first off, we have to give a lot of credit to our hospital systems in managing what was a crisis, and trying to really adapt to a fluctuating need and demand for certain types of beds, either hospital inpatient or ICU beds, with only a limited amount of staff, right? So you can't have a bed available if there's no one to staff it. That's it. So the bed could be sitting there, but if you don't have a specialized nurse to treat that person, that bed's there, but no one could be in it.
It doesn't count.
So it doesn't count. And so when we looked at that data, it was really interesting because you kind of saw this gradual incline of beds being used, but you then also saw a gradual decline in the number of beds that were actually available due to, I think, staffing issues being one. But I also think hospital systems were pushing, okay, we need more staff over our inpatient beds. But next week, some of these patients are getting bad. So we're going to shift more resources towards our ICU beds, take away some of the beds in the inpatient hospital side. And so I think they were just navigating a very fast changing and fluid scenario every day to try and manage this. And kudos to them, because I think they did a pretty wonderful job. And I think another thing that needs to be mentioned is a lot of these, particularly COVID patient beds, either ICU or inpatient, were taken on by our more urban hospitals. Most of our hospitals located in rural areas, weren't dealing with ICU beds or having COVID patients take up a bed in their inpatient hospital beds. Those patients were being transferred to larger hospitals that had the resources and the infrastructure to deal with those patients. And so, I think at the end of this, there's going to have to be kind of an appreciation follow-up of like, hey, all the workers in these hospitals, thank you so much for taking care of our patients that might have been from a more rural area. That's going to have to be acknowledged.
Yes, absolutely. And then we have the financial health of the hospitals through all of this. It wasn't the greatest before the pandemic. We were doing, analyses on that, in 2018, 2019. And then the pandemic hit and we were kind of like, ooh, what's that going to do to the hospitals now?
Yeah. And unfortunately, we don't have the financial data right now. So again, at the state of Minnesota Department of Health, every hospital has to submit kind of a bunch of financial information and about a bunch of information about their hospital at the end of the year. It's called the hospital annual report. Great data. You could sort through it all. And we can essentially look at kind of what I call profit margins, but these are all nonprofits. They're not, making profit, but look at their margins to kind of figure out how they're doing financially. How healthy are they or unhealthy are they? And that data for 2020, when COVID started, we don't have that data. Only the data that just got released, I think like last month or the month before, was the 2019 data. So at least we got a picture of like right before the pandemic hit, how are our hospitals doing? And then it'll be really interesting next year when the 2020 data comes out to kind of take a look. And I think we'll see some interesting things because there is so much government money being pumped to our hospitals to help, beef up their infrastructure and kind of keep them essentially liquid for a while. But in 2019, the trend that we've seen from years previous is that the more rural our hospital is, the more likely it's probably not even breaking even. And so in 2019, we looked at average margin. And for folks that doesn't know, maybe don't know what a margin is, essentially it's the amount of either profit or loss after all expenses have been accounted for, the amount that's left over either in profit or in loss as a percentage of the total revenue you brought in as a hospital. So that's a margin for any sort of business. And you talk to anybody, kind of any hospital executive, and they're going to tell you they would love to be around 4%. So meaning you have 4% revenue left over after you've paid all your expenses, right? And that can help then reinvest in capital, capital improvements and staff and growth, things like that. So and with that 4%, our average margins for our entirely rural hospitals was negative 1.2%. So essentially, on average, not a good one. No, not even breaking even.
Going in the right direction.
Yeah,
very much.
And if we went to our hospitals that were town rural, they were breaking even. That was their average margin, was 0. And then the more urban we got, so for urban town rural counties, they had a average margin of 1.8% in 2019, and then our entirely urban hospitals had an average margin of 4.5%. So on average, they were doing better. And again, there's some variation, and there's some hospitals doing better than others. But on average, 4.5% for entirely urban counties.
And what do you think is driving that trend? Because entirely rural counties and hospitals in entirely rural counties have just been on, from 2016 through to 2019, have just been kind of on a general downward slide profit wise. What's going on there?
I would say probably a couple things. One of the main things is that there's a pretty significant shift that has happened and is continuing to occur in how we fund healthcare. That's probably one of the longer policy stories in America, is that we spend a lot on healthcare and have some of the lowest health outcomes, right?
Mm-hmm.
Particularly compared to other industrialized countries.
Yep.
And so policy has reacted to this in a way that says, all right, we're going to change the way that we fund healthcare, and we're going to change the way that we measure healthcare. And on the funding side of things, essentially, it has meant that we're going to really start funding based on outcomes, not based on services provided. And what this has meant is, let's say for insurance companies, health insurance companies, they can now say, for that particular, like, let's say disease, you're treating somebody that has heart disease. We're paying, and this is a generalization, it's not quite how it works, but it gives you the idea. We're paying $20,000 per year per patient that is going through this type of procedure and has this type of outcome. Doesn't matter if you spent more, if that patient was way worse and you had to spend more, or it doesn't matter if that patient wasn't as severe and it cost you less to treat it. That's what we're paying, right? It's kind of like car insurance. Essentially, our hospitals now have to use economies of scale, have a big pool of patients with a lot of them that are not so costly, and then probably have a few that are super costly, that it then kind of balances out. It's like an insurance company saying, all right, we're going to try and get a whole bunch of good drivers in our pool that don't cost us much, because we know there are really bad drivers. And we want as few of those as possible. And then we spread that risk out, right?
Mm-hmm.
And so, like, that's been the pressure and the push for particularly hospital and healthcare systems to take on, is that type of mentality. And so with hospitals that are in our entirely rural areas that typically have a smaller patient pool, and that patient pool is unhealthier, probably costs more, is older, requires more services, and then those hospitals aren't getting reimbursed at the same rate as what it actually costs to serve that population, because they're getting reimbursed as if their population is a more urban, healthier, younger pool.
Mm-hmm.
This is just the gradual, it's the constant thing we see when we look at policy in rural areas, is that the economies of scale just don't work. And so that kind of change in policy is really impacting hospitals and it's really squeezing them. And it's why you see, a lot of local clinics and healthcare providers that are in rural areas asking to be bought by larger healthcare systems, because they know that's the only way they'll survive, is if they kind of combine their pool with a much larger pool. And some hospitals haven't done that yet, and are trying to come up with creative ways to do it. But it's and things are just getting more expensive. The equipment's more expensive.
Mm-hmm.
The services offered are getting more expensive. To attract staff is becoming more expensive. So all these things are playing a role.
Yeah. So that leads us into, our economic section here now. It's in the COVID report that we're putting together for this, we titled this section "An Atypical Economic Downturn," because it's not quite what you would expect in a normal situation.
It really isn't. And this is it ties into, I think, pre-pandemic and the workforce shortages that rural areas have been seeing severely for, since 2000 and at least 2013, right after the Great Recession. And it's kind of one of those things, I think a lot of us in rural areas, we hear people talking about an economic crisis and we kind of look around asking, all right, where is this crisis? We're not seeing it. And that's not to say like things are great and grand, but we just went through a global pandemic. And I think the honest researcher and expert looking at any country or economic system that goes through a pandemic, you would expect a significant recession and a significant decline and a whole bunch of economic indicators. And that's just not what we saw. And this is a very different, it's a different beast. This isn't a recession. It's not an economic downturn like we've ever seen before. And to show, like, we put together a few charts. I always love talking about job vacancy rates because I feel like, it's something we've talked about for a long time, and more recently has really started to hit a lot of major newspapers as something that we need to pay attention to. Before the pandemic hit, the job vacancy rate, which is the number of job openings as a percentage of the number of jobs that are actually filled. So the higher the rate, the more challenging it's likely going to be for an employer to find a pool of applicants to apply for their job. We consider 3% job vacancy rate to be pretty healthy. That means you have enough jobs on the market that people have opportunity, but you don't have so many jobs that there's still a pool of applicants going for each individual job to make this whole system work, right? So before the pandemic began, let's say 2008, 2019, we have places, regions outside of the 7-county metro, like Northwest, Southwest, even Northeast, that were over 6% job vacancy rate. That's insane. That's absolutely crazy bonkers. By 2020, so the 2020 data came out, and that was right when the pandemic hit. And I think all of us expected the job vacancy rate to just tank. You had all these businesses that had to close, tons of people laid off, right? Like, the job vacancy rate's just going to be like 1%, or maybe it'll, during the Great Recession, the job vacancy rate was right around zero, between 0.5% and 1%. Still in 2020, the job vacancy rate was 4% or higher. Even 7-county metro was 4%. In Southwest, it was 5.2%. I mean, it's still really high job vacancy rates. And I think a couple reasons for that is, one, it really kind of depended where the service industry played the biggest role. So like in Southwest, the service industry isn't huge, right? But manufacturing, which had to keep going, was an essential service, deemed an essential industry, had to continue through the pandemic. They had to hire. And I think you had people getting sick, leaving the workforce. And so they were trying to hire people back on. I think it was just, you had a lot of stuff going on. And so it stayed pretty high.
And you look at, I think the thing here is that the economic impact of this wasn't over everybody like it was, say, in the Great Recession. The impact was very particular about which industries it hit. So like you're mentioning the service industry, that was what was hit especially hard, was the restaurants and movie theaters and those related things. And so, like you say, when you look at the data for Southwest Minnesota, where manufacturing and healthcare are the biggest employers, those were the ones that were going to keep going and still needed people during the pandemic. Whereas you look at the metro area, the biggest employers there are service industries, finance, things like that. But you think about the concentration of restaurants and you look at their employment rates and how they were affected. And it's very apparent in the metro area what happened there.
Absolutely. And we also set up policies to essentially incentivize people to kind of hang out on the sidelines for a little while, because we expected those jobs to come back. We didn't, so I think people were trying to hire, but you're trying to grab from a pool that are sitting and just kind of hanging out, waiting for their old jobs to return, because that was the expectation, right? This is a blip. Let's get through this for 6 months or whatever. And then we expect to be open again and get back to your jobs, which I think was very appropriate at that time. And so, you kind of had this logjam of, like, you had increasing economic activity in the manufacturing and healthcare. They needed more workers, but yet we didn't produce more workers because the sector closed. We essentially floated them for a while, platooned them for a while. So they would kind of just hang out. It wasn't as if a normal recession where a few industries tank, all those people are unemployed looking for work. This was a situation where entire industries closed down, but those people weren't looking for work at the time. So it's just a very different, it's a very different situation.
And you could see that actually really reflected in the sales tax revenue. So I think those charts that you have on the local option sales tax are really interesting. And I should mention, again, we're talking about this on a podcast. We're talking about visual things. We are putting all of this together into a report that should be coming out in about a month or so, and it'll have all of these charts and narrative to explain them, and it's going to be a really nice starting point for here's where we are with COVID, and then we'll be able to add to it as the data comes in. But sales taxes.
Yeah, so this really ties into something I think a lot of folks are maybe a bit excited about coming out of the pandemic. I know me anecdotally and a lot of my friends, and I think you talked about this and all of our colleagues kind of talked about this, is when the pandemic hit, a lot of us stopped going far out to do our shopping. We kind of just all right, let's just stick to what we know close by, and we don't need to go out to all these places. And what we can't get, we'll just order from Amazon and have it delivered to us.
Yeah,
right?
exactly.
And so you had this really interesting situation in which shopping behaviors changed, that more local people were shopping local, while at the same time increasing their shopping online. So what this means for local option sales tax is that you had more local people shopping local, so you collect those sales taxes, but then you also collect the sales taxes of everyone shopping online.
Right.
And so what this meant for our rural areas, for our communities that have a local option sales tax and counties that do in greater Minnesota, you either saw it stay completely even or even increase during the pandemic. It was pretty wild, right? Like we all expected it to just drop off a cliff. That didn't happen at all. However,
yes,
the 7-county Minneapolis, the Minneapolis local option sales tax totally dropped off a cliff. And it really makes sense, right? You didn't have Timberwolves games. You didn't have people coming to Twins games. You had all these things that bring in large amounts of tax dollars into your community
with
because
the
you have all these events.
associated hotels and restaurants and things like that.
All of that just was wiped out. And so that they were really the main ones to get impacted the most negatively is Minneapolis. And so I think, looking forward from a policy perspective and even from a news perspective, when we talk about maybe an economic crisis or we're talking about this being hard on the economy, I think for places like Minneapolis, maybe probably St. Paul and other places that really rely on things being open, people attending, really being a tax importer from regions around the state, they got beat up bad. But that money that wasn't being spent there was being spent in their local communities. So they were no longer exporting their tax dollars, but rather spending those dollars in their local community or on Amazon, where the tax dollars still got collected. So that's kind of the big story coming out of that.
And one thing I noticed here in Mankato, and I don't know if you saw it in New London and Wilmer too, but when this all started and the restaurants had to close, but they were offering takeout, a lot of restaurants that weren't doing takeout, they were sit-down restaurants, started doing that. And the local chamber here started a Facebook page. So all these restaurants could just say, here's our family night special, meatloaf dinner for 4 for $20, and it gave them an opportunity to really advertise things like that. And I really think people in town saw this as a way of supporting their community, was by spending money at their local restaurants, and keeping them alive. And so I think there was that community vitality kind of aspect to it too, where, let's support our local businesses.
I think you're right. I think it was a combination of necessity. Okay, we can't go out, so where can I find this stuff local? And 2, these guys are still doing it. I see how much they're suffering because of this. Let's go help them out. I know these people. And I know in New London and even Wilmer, talking to let's say New London here, we have a lot of boutique clothing stores. I was expecting them to say I expected a lot of them to close shop. And when I went around talking to them, they're like, no, actually we had one of our best years, because it was a combination of, we didn't make as much revenue But we still had a really good customer base that came and shopped, and we were able to significantly lower our expenses through reduction in staff, and government payouts helped a ton too to kind of keep them afloat. So that combination of things really did help them. And I would argue help them kind of rethink coming out of the pandemic now and how their business model functions. I've heard from so many of them. They're like, yeah, we kind of learned how to do this without having so much overhead. Either through less inventory or less staff. I think it just changed up a lot of things. And even in the restaurants now, their ability to do takeout has changed significantly. You can tell the investments they make. You can order stuff online with all the restaurants here now. Like they just kind of, that infrastructure that they invested in continued. And I think it's paying off for a lot of them.
Well, and one thing too about, you're talking about people not going to the Twin Cities for sporting events and whatnot. But when you look at resorts up north, and they kind of had banner years these last 2 years, didn't they? Because everybody wanted to get out of town.
That's it. Yeah. I mean, it's funny because I think when we talk about community support, I remember seeing articles and talking to some of my friends that are in the Twin Cities that, oh yeah, we just tried to shop at all these local restaurants as much as we could, in South Minneapolis or whatever. I think they did that, but because their economy, that's such a small slice of their overall economy with the hotels, lodging, food, people coming from the outside is a huge portion. You took all that away. You would think that would then be the same for resorts on the North Shore and things like that. But that actually became the destination for a lot of folks because they're like, all right, I'm going to go somewhere where there isn't a lot of people and there's just nature. I remember hearing like it was a banner year for the Boundary Waters and all the campsites up there. Where it's just like, everybody's like, this is my 1 year, I'm off. So I might as well try this out. I've always wanted to try it.
Yeah. And the
they did really
resorts
well.
were just like at capacity, completely at capacity all summer. And, even into the winter, some of them. But
and I remember too, it was at capacity while also lacking staff. Right. So I think it was awesome, but stressful at the same time for a lot of them.
Yes. Now on another, workforce based finding, it was remote work turned out to be pretty interesting and pretty telling, the stats on that.
I mean, so Deed put out a report, wrote a really great article. Go check it out if anybody has a chance, looking at the number of jobs. They kind of went through their, what do you want to call it? Like their job database. So not jobs that are filled, but open jobs that are, on their website. And they just did a quick calculation to kind of figure out, okay, how many of these jobs are offering the ability to do remote work with that job? And it was stark when you looked at the jobs by region. So in the Twin Cities Metro, 13% of the jobs available were being offered as remote. You could do them remotely. That's huge. Like, I mean, previous it was 1%. It went from 1% to 13% in like a year.
Yeah.
That's pretty significant. And I don't know if we'll see that change much. It might decrease a little bit, but it kind of might be the new thing. Northeast Minnesota, interestingly, was really high too, 8.2%. I found that kind of surprising, but really cool to see. The next one was Southeast, so like Rochester and some of those areas, was 7.5%. So those were the top regions with the highest percentage of their jobs available that were being offered remotely. And then it just went way down. So the next highest was Northwest Minnesota at 2.4%. So we went from 7.5% of jobs in Southeast being remote to Northwest being at 2.4%. And then it was 2% of the jobs in Central and Southwest. And again, I think this is industry makeup. In Southwest Minnesota, you have a lot more jobs that are manufacturing or kind of hands-on. You need to be there. So you can't do those remotely, where, the Twin Cities and some of those other places, it might be more finance, research those types of things that can be done remotely. So yeah, it's kind of interesting. But again, I mean, even that 2% in Southwest, I guarantee you, the year before it was probably 0.2%.
Right.
Of jobs available. So that 2% is still pretty crazy jump, but yeah.
Yeah, I think as far as remote work goes, I think we've kind of crossed a threshold, a watershed now. We used to do a lot of research on broadband, and there was always this discussion of how do we convince employers to let their employees work remotely, and, oh, we need to change this culture of having to have butts in seats and the supervisor being able to watch employees. Well, you know, we were forced to change that now in the last 2 years. And so I think we've crossed that line. What do you think?
So one of the things coming, or some of that research, I should say, coming out of the University of Minnesota Extension actually dived into this idea of like, all right, we saw a lot of people that had to go remote. Is this kind of a watershed moment, and how have employers learned from this transition? And it was really fascinating. One of the biggest things is employers learning on the fly how to implement policies to kind of like track progress, make sure people are doing their work, what this looks like. It's a very different, I don't know what you'd call it, like framework of having people right next to you versus not being able to see them and having only to track their progress by the work they do rather than what you see them doing, right? And so I think employers are starting to figure this out. They're trying to figure it out. But I think a lot of them too are realizing that maybe some sort of hybrid, maybe we need to see you once a week or once every few weeks just to kind of check in on a few things. I think management in particular is trying to figure this out the most, right? So I think a lot of people that work from home, they're fine with it. We figured it out. I think it's management. They're trying to figure out like, all right, how do we appropriately, one, measure progress being made and and keep track of things, but two, how do we support our employees to make sure they're comfortable at their home?
That they can do their jobs.
That they and do it well and take care of their bodies, and do we know how to do all these things? So yeah, I think they're working through it, but now it's just kind of the big questions. I think you're going to see a lot of stuff, kind of best practices coming out now, things learned. They're going to start sharing a lot of stuff to try and figure out how to best do this.
Right. Yeah. And so staying on that employment topic, one of the big findings, not just with us, but that everybody was noticing, was how the pandemic affected the number of women in the workforce. We could look at the employment numbers overall, but when you started breaking it down by men and women, you saw a real definite impact there.
Well, yeah, what's interesting is I saw it particularly if we broke it down by ruralness and urbanness. And I was actually a little surprised by this. So in the 7-county metro, well, let's just say the number of people overall participating in the labor force has declined across the board. It doesn't matter if you're rural, urban, it's gone down. Not a big shocker to anybody if you've been following the news or own a business or trying to hire folks. That occurred. But when we broke it down by gender, what's interesting is in our entirely urban counties, so our very urban counties, 7-county metro, and some of the other places outside of the 7-county metro, is that the drop in the labor force among female and male was about the same. I was kind of surprised. It was a very similar drop. The largest, but when we got outside of the 7-county metro, that's where we saw a bigger drop off. More females dropped off as a percentage of the female workforce left the workforce compared to males. And that was kind of interesting. I don't know if I have a great explanation for it. Maybe you do, Marnie.
Well, yeah. I think people figured out pretty quickly that, in a lot of families with kids, the parents just decided that when all the schools closed and the kids had to stay home, when push came to shove of deciding who was staying home with the kids, it was the women, the moms ended up staying home with the kids. And so I think you really see that reflected in the data when you see that drop off from 2019 to 2020 and into 2021. And the thing is that, it's still a little early to see how much overall those workforce numbers have recovered of people going back to work. But what we do have shows it's pretty apparent that the men, are going back to work, but the women not so much. that number for women too is increasing, but just not nearly as much, or it's even staying flat. And so that just leads into, the issue of childcare and,
Yeah.
my big topic. And so, yeah. And I mentioned on a webinar not too long ago about, the last 2 years being chaotic for childcare and childcare providers and families. And I've had providers say, yep, chaotic was exactly the right word. It was, it had a huge impact on childcare providers. In Minnesota, at least, they didn't necessarily have to shut down, or they didn't, or maybe they did right at the beginning. I don't remember exactly, but then they could open back up again when they could get their, their sanitization practices in place and everything. But it did have a big impact on just their ability to look after kids. There were staffing issues. There were families who decided to just keep their kids home and not send them to daycare. So if the kids didn't have to go to school, if, mom or dad didn't have to go to work, then let's just keep the kids at home and save some money. And so it was those two big things: staffing issues, increased expenses, and not just from sanitizing. Some of those expenses, maybe a lot of those expenses, also had to do with the fact that, in some industries, in some businesses, workers could make more money staying home on unemployment than they could at their job. And childcare, unfortunately, was in one of those situations. Or the staff members got sick and couldn't come in for 2 weeks, or they just didn't want to come in because they were concerned about getting sick themselves or bringing it home to family members who had, health issues. And they didn't want to get them sick. And so you had a lot of staff, dropping out. And it was just, it was a mess. Now, interestingly, when you look at the numbers overall, when you look at the number of providers in centers versus family providers, which are the in-home childcare, the family providers, the capacity for that overall has been dropping steadily for the last 20 years. But in the last few years, that drop was like they were losing 5,000 slots a year statewide, 4,000 slots a year, 6,000 slots a year statewide in family childcare. In 2020, they actually only lost about, if I remember correctly, it was about 3,000 slots. So that was actually an improvement. Now, that doesn't reflect the number of providers, whether they were family or centers, that closed, and the ones that then also opened in 2020. That's going to take a little more digging to figure that out. And, and did the pandemic have an impact on providers closing any more than in pre-pandemic years? But one thing that is pretty certain, anecdotally at least, is that the emergency grants that the state started right away were an absolute lifeline for providers. We would have lost much, much more capacity if the state hadn't been giving those, providing those emergency grants to providers just to make them whole, to make up for the income they were losing from their families and their increased expenses. I've heard in other states who didn't do similar grants like this, losing just tragic amounts of childcare capacity, like half their childcare capacity. And so Minnesota actually got off fairly well in that situation. And so, yeah, so it'll be really interesting to see what kind of lessons we can learn from the last 2 years, just in how maybe solutions, maybe what is the core problem and what might be the core solutions to figuring out childcare, because it has certainly been a very interesting unintentional experiment.
I think in general, if we were to look at this data, so not only childcare, but the economic data. So if we leave out the tragicness of sickness and death and those things, but look at where I feel like policy really tried to make the biggest impact, which was let's deal with this public health crisis, but let's support our businesses, our childcare, and everything else in the best way possible. Looking at this data, I would say Minnesota was pretty successful. Things are tough, don't get me wrong, but again, it was a global pandemic, and we're walking out of this, I don't want to say unscathed, but in a sense, like I feel like there's a lot of optimism here. And that's the one thing I think I get frustrated with, particularly in the current discourse of how we talk about politics or policies or and things like that, is that we never take the time to pat ourselves on the back and say, hey, you know what? This was crazy, but we did all right. Like we've kind of figured some things out, and we helped people out, and businesses were relatively able to stay afloat, and they were able to, and businesses did really good at reinvesting and rethinking. And you know what? We maybe learned something from childcare about, subsidizing it might be a good idea. You know, like I feel like if we would just take a moment to focus on what we did right on this, there's a lot to be hopeful for. And that's kind of my big takeaway here.
And how well we did at each level, from state on down to local, just the grassroots people, you know, putting their minds and creativity to work to come up with a way to address their corner of the world. You know, again, in Mankato, we had the Facebook group called the Mankato Toilet Paper Sighting Facebook group. And that was born out of the toilet paper shortage. But it turned into, cleaning supplies and baby formula and pet food and things you couldn't find. And then it became kind of a community discussion thing. And then for a while, it was kind of a public safety thing. And it was just kind of neighbors watching out for each other, but just taking the initiative and showing that they didn't have to wait for someone to come along and save them, which was my favorite thing out of all of this. Yeah.
It was a good combination of, I would say, government intervention and people doing what was right and good and taking it upon themselves. It's what we would hope for,
right?
In a situation like this. Yes. I just wish we would actually acknowledge it and take the time to say, good job.
Nobody talks about the 1 million people who crossed the street successfully today.
Right.
So, yeah. So,
well, I'm looking forward to getting this published. I think to our listeners, we're working on it now. I think probably in the next few weeks, we'll have something on our website to kind of show people, and looking forward to it.
Yeah, we'll have this report, and we'll be doing another webinar around this report more specifically. And so that's something to look forward to.
You've been listening to the Center of Everywhere podcast, where we explore stories of rural Minnesotans who are making a difference in their communities. Rural isn't in the middle of nowhere. It is in the center of everywhere.